welcome back to Trends and Friends, everyone. Stephanie is joining me with Star Care. We're talking about their COVID hotline. Obviously, lots of different things happening with COVID, but kind of tell us why y'all got this started.
Well, our program is operated by the Health and Human Services Commission. We got a grant through the Federal Emergency Management Administration to provide services to people who are struggling due to COVID-19.
Yes, COVID definitely is affecting a lot of people. What kind of things can you help with?
Well, our main mission is providing two things. One would be skills training and coping skills to manage anxiety, stress, depression, all those things that we're seeing due to COVID-19. And the other thing would be referrals to community resources. So if people are needing more long-term interventions, we can get them connected with psychiatric care, counseling, resources to help with financial difficulties, job problems, things like that.
And how do they call? And then for pricing wise, if they are struggling with pricing, how much is this going to cost for them?
This is completely free to the community. You just call our hotline. We operate 9 a.m. to 6 p.m. each day. And this is anonymous. So we collect basic demographic information, age range, gender, things like that, but we don't keep records of anyone's name. So it remains confidential.
And what is that number for people if they want to call?
That number is 806-740-1450.
I know y'all been running for a little bit. How has it been so far? Are y'all seeing that there are people that are in need?
Absolutely. There's a need in Lubbock for these services. I think not a lot of people know about our program, so it's wonderful getting to talk to you today, get the word out. But there are a lot of people who've been dealing with some emotional and financial difficulties due to COVID, particularly healthcare workers, education workers who've been hit the hardest by this pandemic.
It's definitely not easy to talk about these things to your loved ones, let alone, strangers calling on the phone. So how will it be for them? Kind of walk us through what they can kind of expect to make them maybe feel a little bit better to call.
Well, first we talk about what their initial concerns are going to be. Our hotline workers are very supportive, understanding. There's no judgment here because we do understand that everybody reacts a little bit differently. So talk about their initial difficulties and then maybe strategize ways to address those difficulties.
And so once that does happen, is this something that will go and y'all will give them to someone else? How does that work? How does that work from after that phone call?
It depends on needs. A lot of folks would prefer follow-up, so we can arrange that. Either myself or my supervisor can follow up with them on how they're doing or get them connected with other resources that they're needing.
How long is this hotline going to be available for people? Is there a deadline or is it going to be going for a while?
Currently, our grant runs through June 30th of 2021, and there's a possibility that could get extended. We're just going to have to see.
Awesome. Well, thank you so much for being here. I hope this really helps some people.
Well, thank you very much.
Of course. We'll have some more Trends and Friends coming up after the break, so don't go anywhere.